You're listening to Chapter 4, The Southern Spark. One day, I know the struggle will change. There's got to be a change. Not only for Mississippi, not only for the people in the United States, but people all over the world. Fannie Lou Hamer, in a 1964 New York Times interview.
It's 2013, and Shayla and Eric are fresh out of college, recently married, and living near Shayla's family in the Mississippi Delta. It seemed like the next logical step would be to start a family, but their attitudes about having children were totally different. Shayla wanted kids. Eric didn't. But despite that, they started having more conversations about what parenthood could look like and what it would take to get pregnant.
We were starting to plan it, but we weren't like planning. And so around 2013, I started to get into, I bought this book called Honoring Our Cycles and learning how to chart and track my fertility. So I got into that. I think I had read the Queen Afua book, Sacred Woman. I was like reading that. So I started to get into trying to be fertile, I guess. One night I woke up and I was having these really, really bad cramps, and I didn't know what was going on. And so the next day I went to a clinic. I left work and was like, something's not right. Like I'm bleeding, I was cramping, I don't know. Like I'm gonna go to this clinic.
The sudden pain was disorienting for Shayla because she'd already taken a pregnancy test and it came back negative. She wanted to get checked out. The only thing was, the nearest hospital was known for really long wait times and being short-staffed. Her other options, including a women's clinic, were more than 30 minutes away. But Shayla needed help now, and she needed it to be convenient, both for her time and money. At the time, Shayla was working full-time at a nearby Catholic Services Center, making $13 an hour. However, the job didn't come with health insurance, and Shayla just assumed she wouldn't qualify for government aid. It was a fair assumption, considering that even today in Mississippi, non-disabled and non-blind adults under 65 are ineligible for full Medicaid benefits, no matter how low income they might be. So she didn't even bother to look into Medicaid. Shayla just went without insurance altogether. She called Eric and told him she was going to a free clinic around the corner from her job in Mound Bayou, Mississippi.
And I think he met me there, and the nurse midwife was just mean, for no reason that I could see. And she was like pretty much blaming me for my health. She just thought that I was unhealthy, and that was all she kind of gathered. Like, oh, you've been eating this, and you've been eating chips and cookies, and who is this, your friend? You know, like she was referring to my husband. And I'm like, hey, right, he's my husband? Like, what is wrong with you, you know? But I had taken a pregnancy test, and when I found out I wasn't pregnant, there was a level of hurt behind that. And so I was already hurt when she came in and said, no, you're not pregnant. But then as she jumped on me after that, it just hurt even more. So I was kind of like just paralyzed with hurt. I didn't even defend myself a lot in that whole situation.
Even though they were still unsure if they were ready to have kids, the news still hurt. The couple left the clinic with no real answers as far as what was going on with Shayla's body. Why was she in so much pain? Why was she cramping? So she was left to figure it all out for herself.
And then when I got home, I Googled it, well, what in the world just happened? And I found out I had a miscarriage. And that pretty much began me figuring out my health for myself.
That visit to Mountain Bayou would stay with Shayla and Eric long after that day. And it would also connect them to a long history of freedom fighters whose lives were forever shaped by that very town.
For 300 years, we've given them time. And I've been tired so long, now I am sick and tired of being sick and tired. And we want to change.
I am sick and tired of being sick and tired. Fannie Lou Hamer delivered those famous words at a 1964 rally in Harlem, New York. Fannie Lou Hamer definitely isn't as widely known as she should be, but for those who do recognize the name, She's generally talked about as a fierce voting rights activist during the civil rights movement. But there's so much more to her story. Born in 1917, Fannie Lou Hamer was the last of 20 kids for Ella and James Lee Townsend. Home for them was Montgomery County, Mississippi. And just like her older siblings, Fannie Lou joined her sharecropper parents in the cotton field at the age of 6. And though she could read and write, by the age of 12, Fannie Lou had left school to work with her family. Years later, she'd marry Perry Hamer, and the two worked side by side as sharecroppers on a plantation near Ruralville, Mississippi. And they had dreams of starting a family of their own, but Fannie Lou had trouble conceiving, including several miscarriages, so the couple would later go on to adopt 4 girls. In 1961, Fannie Lou Hamer went to a local hospital in Sunflower County to have a tumor removed from her uterus. When she woke up, she was informed that the white doctors had removed her entire uterus by performing a hysterectomy without her consent. Fannie Lou Hamer was the victim of what is widely known as a Mississippi appendectomy, a phrase used to describe the forced sterilization of Black women, mainly in the South, but not always. Oftentimes, people were admitted to the hospital to get their appendices out, but would involuntarily get a full hysterectomy or their tubes tied for no valid medical reason at all. And these weren't one-off situations either. Forced sterilizations have always been a part of a much larger eugenics movement propped up by the U.S. government to limit Black population growth.
Fannie Lou Hamer was determined to protect other Black women from suffering the same fate. So a year later, on August 27, 1962, she and her husband attended what was called a mass meeting at William Chapel Missionary Baptist Church in Ruralville. They heard from organizers with the Student Nonviolent Coordinating Committee, also known as SNCC, and the Southern Christian Leadership Conference, aka the SCLC. Folks like James Bevel and James Foreman explained to the crowd their constitutional right to vote. For many in the audience, including Fannie Lou, this was the first time they had even heard Black people could register to vote. Inspired by what she'd learned, Fannie Lou Hamer, at the age of 44, set out to vote. She now saw the ballot box as a potential solution to the many injustices she and other poor Black folks faced every single day, from sharecropping and food insecurity to lynchings and Mississippi appendectomies and everything in between. 4 days after that mass meeting, Fannie Lou Hamer went to the Sunflower County Courthouse to register to vote. But as was common in 1960s Mississippi, she failed the literacy test and was turned away. This would be a major turning point for Fannie Lou. While she would go on to become SNCC's oldest voter registration worker, co-found the Mississippi Freedom Democratic Party, and even run for Congress,
We need your vote, because if I'm elected as Congresswoman, things will be different. And we are tired of people saying that we are satisfied, because we are everything but satisfied.
this struggle for freedom wasn't new to Fannie Lou. In fact, these seeds were planted a decade earlier.
In the 1950s, Fannie Lou Hamer attended a rally hosted by the Regional Council of Negro Leadership, better known as the RCNL. In short, the group's mass meetings were like part pep rally, part old-time revival, and part Sunday church picnic all in one. There, Fannie Lou, as well as other budding activists like Medgar and Merle Evers, they spoke out against police brutality and helped to organize RCNL's first boycott of gas stations with the slogan, "Don't buy gas where you can't use the restroom." Thousands would flock to the annual RCNL conference to hear speeches by Black leaders like Thurgood Marshall, as well as thunderous performances by singers like Mahalia Jackson. This was a type of well-organized Southern resistance that could have only originated at one place: Mount Bayou, Mississippi.
Known to this nation as one of the first established all-Black towns, Mount Bayou, Mississippi, founded in 1887, incorporated in 1898 by former slaves, for decades has been known for its rich culture and African American history. Join us today as we visit Mount Bayou, Mississippi.
About 20 miles east of the Mississippi River in northern Mississippi, Mound Bayou was founded by three cousins, Isaiah T. Montgomery, Joshua P. T. Montgomery, and Benjamin T. Green. It was one of the nation's first all-black towns. These three cousins had a vision. They wanted to create a city that could be a place of refuge for other black folks. As the town grew, Mound Bayou became known as the Jewel of the Delta, a place where black people and the black dollar flourished. There was an active local government and civic life, a thriving economy including a bank, various businesses, and its own school system. Before the Great Migration and Great Depression, the population hit a peak of 8,000 residents. In many ways, Mound Bayou was a black utopia, a place where black people could belong safely and successfully after generations of bondage.
And then, in 1942, construction began on Taborian Hospital. It was the town's first hospital and the first ever opened in the Central Delta. Taborian was also part of a much larger black hospital movement dating back to the end of the Civil War, one that birthed other medical facilities like St. Agnes in Raleigh, Lincoln Hospital in Durham, and Washington, D.C.'s Freedmen's Hospital, now known as Howard University Hospital.
Taborian and its team of largely HBCU-trained nurses and doctors provided low-cost medical care to residents across the Delta. And its first chief surgeon was a man by the name of Dr. Theodore Roosevelt Mason Howard. But most folks just called him TRM Howard. In addition to his work at the hospital, in 1951, Dr. Howard founded the Regional Council of Negro Leadership, the same organization that introduced Fannie Lou Hamer to the civil rights movement. Dr. Howard took Fannie Lou under his wing, mentoring her as she continued organizing on behalf of poor black Southerners as the founder of the Mississippi Freedom Democratic Party.
Fast forward to the late 1960s. The Great Migration is slowly winding down. Segregation, at least legally, is officially off the books. And black folks were settling in big cities around the country outside of the South. And when it came to their medical care, they also had more than just black hospitals to choose from now. But these demands for integration also seriously challenged the very notion of these hospitals too. While there were more black doctors and nurses than ever before, with so many newly integrated institutions, black medical providers could now practice outside of black hospitals, and they did. These changes, for better or worse, affected all black hospitals, including Taborian. And in the face of those changes, plus ongoing financial woes, Taborian Hospital ultimately ended up under federal control in 1967.
10 years later, on March 14, 1977, Fannie Lou Hamer took her last breaths at Taborian. She died from breast cancer and high blood pressure complications. And then, in 1983, Taborian Hospital, the heartbeat of Mound Bayou, closed for good. Decades later, when Shayla and Eric Brown headed to Mound Bayou, the illustrious hospital of Fannie Lou Hamer's time wasn't there. By 2013, there was at least a clinic, but nothing comparable to Taborian.
It was a free clinic that was kind of touted as the place to go. It was like the urgent care for that area, if you will. So a lot of people went there for general stuff, if you didn't want to go to the hospital, if you couldn't make it to the hospital, or just to do things like annual checkups for women. So it was a clinic that the government had put a lot of resources into.
Taborian's closing wasn't an isolated incident. It foreshadowed what would come next, a phenomenon of hospital closures and transformations that would continue over the next few decades into modern day. And each time, these decisions left Black rural folks, especially pregnant rural folks, with fewer and fewer options.
Here in Richland, Georgia, just 2 hours south of Atlanta, it's a different world from the big city. Access to basic services, including a hospital, is not a guarantee.
Some people call this a crisis. Some people say it's just the changing nature of healthcare. But as more and more of Tennessee's rural hospitals shut down, people are getting sicker, communities are being devastated, and lives are being lost.
So in 2004, it was about 56% of rural counties had hospital-based obstetric care. And over the next decade, we saw a decline so that in 2014, more than half of all rural counties had no place where you could give birth.
That's Dr. Katie Cosmanil. She's a white and indigenous mother, a maternal health advocate, and the director of the University of Minnesota's Rural Health Research Center.
We found that decline was concentrated in rural counties with a higher proportion of Black residents, Black reproductive age residents. So where can you give birth when the nearest hospital is further and further away?
Dr. Katie's work largely focuses on access to reproductive care in rural America, and she's not the first to ask this question. But the reason she started thinking about it, well, it's a pretty interesting story.
So what happened, it was 2016 when this group of grannies, their daughters were having babies and they were noticing the hospital closures around them because their daughters had to travel further to get prenatal care and ultimately also to give birth. And they were concerned about that and went to their legislator, Representative Terry Sewall, and Representative Sewall's staff contacted the National Rural Health Association, which is sort of a leading figure in rural health. And the folks at the National Rural Health Association called me. I had been leading rural maternity care research for about 5 years at that time, and they asked me, are rural hospitals closing their obstetric units a lot? Is that happening increasingly? Is it happening more often in some communities versus others? And I was like, that is an excellent question that hasn't been answered or hasn't been answered since the 90s. That was the last time we had sort of looked at that across the country from a research perspective. And I said, I don't know the answer to that question, but I know how to find it.
We wanted to know who these women were, but unfortunately we couldn't find their names, so we're going to affectionately refer to them as the grannies throughout this episode. And so after speaking with the Federal Office of Rural Health Policy to okay the research shift, Dr. Cosmanil and her team got to work.
And our research showed that those grannies were exactly right, that there was a loss of obstetric units in rural communities across the country. And that communities like theirs, rural counties that had a higher proportion of Black residents, rural counties in states with less generous Medicaid programs like the state of Alabama and many states in the Southeast, counties with fewer doctors, with a lower number of both family physicians and obstetricians were more likely to lose these services.
So let's keep it simple. Between 2004 and 2014, the percentage of rural counties without obstetric services increased from 45 to 54%. In the same period, of the rural hospitals that have remained open, 14 of them have shut down their obstetrics units. What that means is more than half of all rural counties lack access to a hospital obstetrics unit or to a single obstetrician. And this void is felt even more acutely by residents living in what we call rural non-core counties. Basically, counties that have less than 10,000 residents.
What are people supposed to do if you can't learn about your body and plan for your reproductive life and, plan a pregnancy, have it when you want to have it, prevent it when you want to have it, end a pregnancy that you are not ready to bring into the world or that you, for health or other reasons, need to be able to terminate, and bring a healthy baby into the world and get pregnancy care and get childbirth care locally and when and where you need it.
Before the COVID-19 pandemic, more than 500 rural hospitals were in serious financial trouble and at risk of closure. Things like fluctuating revenue streams, availability of hospital beds, and the physical conditions of facilities, well, they all contributed. But perhaps the most influential factor, and one that simply can't be ignored, is the impact of the 2010 Affordable Care Act, and specifically, the option to expand Medicaid. Medicaid is a federal safety net program that provides healthcare coverage to low-income adults, the elderly, disabled folks, and pregnant women and children. and it was expanded under the Affordable Care Act to include even more low-income adults. The thing is, the program is jointly funded by federal and state governments, but fully administered by states, meaning that it ultimately comes down to each individual state deciding whether or not they'll expand the program. According to the Chartis Center, rural hospitals in expansion states decrease their likelihood of closing by 62% on average. And that's because these hospitals are now reimbursed for services that would otherwise go uncompensated, leading to increased revenue and stronger financial performance for hospitals overall. To date, 12 states have opted to not expand these benefits, and half of them are in the South, in places like Texas, Florida, Georgia, and Mississippi. With nearly 60 million residents across rural America, it can be really hard to understand what's driving these hospital closures. But for some, the answer is pretty clear.
Even after the passage of the Affordable Care Act, we still have this uneven policy landscape, deeply uneven policy landscape, in terms of which states have expanded Medicaid.
That's Dr. Ariana Planey. Originally from the San Francisco Bay Area, Dr. Planey is a deaf-blind health geographer and an assistant professor at the University of North Carolina. Her work uses spatial analytic tools to look at the interaction between healthcare access, policy, and health equity.
And it still remains the pattern that the states with the highest shares of Black populations as a total population are also states that are least likely to expand Medicaid. And these are also some of the states that have fared the absolute worst in terms of maternal and infant outcomes. And some of these states also have the widest racial disparities.
Nearly 99% of all babies in the U.S. are born in hospitals. And while the vast majority of Medicaid-financed births occur in urban areas, Medicaid pays for a larger share in rural areas, covering 50% of all rural births. And with the nearest hospital in rural counties moving farther and farther away, the decision to not expand Medicaid is simply rooted in racism and partisanship.
What I've observed in the rural South specifically is that Black rural communities actually have some of the longer travel distances to the next nearest hospital, and that is despite them being more likely to be in census tracts that are adjacent to metro areas. So even with the relative advantage of being closer to metro areas, these are communities that experience the longest travel distances and travel times to care, nonetheless. And these are also communities that are disproportionately affected by closures.
But access to the nearest hospital isn't as straightforward as it may seem.
If you just look at access to the nearest hospital that's open, it appears that Black folks are actually doing a little bit better than white rural communities. But the thing is, there's an implicit assumption there when you say, oh, well, people have better access to the hospital nearest them. That assumption is that people use the healthcare that's nearest them. We know, even in an urban context, that Black people who use healthcare don't necessarily use healthcare the nearest them. That's because there's this complex, fraught relationship between healthcare institutions and Black communities. And so we measured access to the next nearest hospital as a potential backup. And what we found was that actually majority white communities had the shortest travel times to the next nearest hospital, while majority Black and majority Latino communities had the longest travel times and travel distances to the next nearest hospital. Some people may say, it's only a difference of maybe 3 minutes or something. But when we're talking about majority Black, majority Latino rural communities that have heavier burdens of chronic illness, probably higher frequency of appointments, that means that burden is cumulative.
Just like safe housing or access to healthy food, Dr. Planey sees time as another kind of social determinant of health, another condition affecting residents' quality of life.
overall, Black folks have the longest travel distances to care. And so just I layer that on to longer commute times, longer travel times to get to a grocery store that carries nutritious food, longer travel times to access a pharmacy. All of that adds up. And time is a finite resource. Time is an important resource for health equity.
I love learning more about the stories of folks who fight for change like Fannie Lou Hamer and the Black Grannies. It's why I tune into People, Place, Power, a new podcast that explores big questions about activism through the eyes of changemakers around the world. This season, they're bringing you stories about how activists from India to Haiti to Afghanistan are reclaiming their power. Learn how these activists use things like comedy, technology, and the power of their own bodies to create real change. Another podcast I appreciate is Sisters in Loss. Their show spotlights Black mothers who share intimate stories about infertility and pregnancy loss. Every Wednesday, episodes touch on everything from fibroids and PCOS to adoption and abortion and more. As a company, Sisters in Loss also provides full-spectrum doula and grief services to help women step beyond anxiety and fear and into trust and peace after loss. To join their community, go to sistersinloss.com/community. And listen to People, Place, Power and Sisters in Loss wherever you get your podcasts. Now back to the show.
The conversation around rural hospital closures and Medicaid or healthcare access more broadly, well, it can all seem really abstract. But for Eric and Shayla, rural Mississippi is home. It's where they grew up and where their families are from. There was no ignoring what was happening around them because, well, they had been thinking about these big questions their entire lives.
Another thing that rural means is that there's one hospital in each county. That's about as much as you're going to get. There might be some free clinics or a state health department, but the hospital is what you got.
We didn't go to the doctor a lot, one, because it was too far. I realize that now. And then my grandma just always had stuff that she did when there was something wrong. You know, I remember asking her, like, are you a doctor? Because every time we were sick, she was the one who was taking care of whatever was wrong with us.
In Columbus, it's a little different because we're the city with the hospital in this county. And my dad worked at that hospital, so he knew the doctors, especially ER doctors and people who dealt with my broken bones in football and stuff like that. Like, he had connections to all of those people. So I never really experienced any hiccups or problems from the medical system. But with that said, they being my parents, still pushed us to not get sick, take care of yourself, and they tried to handle as many things without us having to go to the doctor as possible. But I think that's a matter of just the poverty that most people around this area deal with, even though they don't know that it's poverty and wouldn't call it that.
It's not just about how much care costs or where it's located. Like Dr. Planey said, how you feel about your provider also affects how you access care, if at all. Growing up, Eric remembers how his mom and her friends had their own way of talking about this too.
I used to hear those women who I would eavesdrop on routinely say, laugh out loud in that beautiful way that Black women do. They would laugh out loud at the notion of going to Baptist Memorial. Like, there was no chance they would. They would all carpool and go with each other to their doctor's appointments in other cities. Now that we're talking about all this, I see why they carpooled. I always wondered, like I know ladies go to the bathroom together, so I thought it was just one of those things. Like, they're going to the doctor together. They're probably going to defend each other, to speak for each other, to give enough amplification to their voices to be heard in their own bodies. But they used to take trips, and they still do. My mom went a couple months ago. Like, they still take trips to go somewhere not here to go see a doctor so they can feel safe. So I didn't have a lot of that personal experience with bad treatment or bad care myself because of the connection I had with my dad, but we were all avoiding it for the same reason.
Without even realizing it, Shayla and her family had been avoiding going to the doctors too. But the day Shayla walked out of that clinic in Mound Bayou with Eric by her side, she couldn't help but to think about all these other times she had gone to the doctor's office. All those other times she walked out wondering who was supposed to care for her.
Even from childhood, I remember thinking when we would go to doctors, like, they never know anything. They never know anything. They do stuff to you, and then you walk away with no answer. All I see is Black people being funneled into systems that are abusing them. And they're the largest ones. You know, they're the main hospital, the main clinic here.
Shayla was over it. She had seen enough, and now she had been through enough.
And I think that was the last time that I was going to allow myself to walk inside of a building and then walk out of it with no answers and then just feel beat up afterwards.
From that moment on, Shayla promised herself she'd be in charge of her own health. She'd have the final say on her body and her well-being. Shayla would never return to that clinic in Mount Bayou. From then on out, Shayla and Eric were committed to figuring out pregnancy and childbirth in their own way. And they knew for sure that when they were ready to try again for a baby, that they would look at home birth and midwifery care. But it didn't stop there. This experience also made Shayla want to become the kind of caregiver she wished she had in the world, the one she needed back in that Mount Bayou clinic. Months after that incident, she completed birth doula training with the hope of supporting other Black parents-to-be. And in the following year, Black doulas and student midwives would turn around to support Shayla and Eric during the home birth of their oldest son, Samuel.
In the mosaic of Black Southern resistance, from Fannie Lou Hamer to the Alabama grannies, all the way to Shayla and the Black women that raised Eric, we're reminded yet again that Black women have always been and continue to be advocates for themselves, and by default, everyone else. In December 2018, 2 years after the Black grannies raised the alarm about rural hospital closures, Congress finally moved to action. In a bipartisan vote, they passed the Improving Access to Maternity Care Act, which designated areas with fewer doctors as maternity care shortage areas. This was huge, because after all, you can't change what you can't measure. And with Black women dying from childbirth complications at 3 to 4 times the rate of white women, data-informed solutions became a driving force behind the Black Maternal Health Momnibus Act of 2021.
Congress members Lauren Underwood and Alma Adams, Senator Cory Booker, former Senator and now Vice President Kamala Harris, along with members of the Black Maternal Health Caucus, have put forth this package of 12 bills. The policies aim to improve how we measure the maternal health crisis by making critical investments in social determinants of health, like housing and transportation, funding community-based organizations working with families, investing in digital tools like telehealth, and even addressing the unique risk posed by COVID-19. In 2021, President Biden signed the American Rescue Plan into law. This COVID-19 relief package includes every eligible provision of the Momnibus Act, including a permanent expansion of year-long postpartum Medicaid coverage. And this will go a long way, especially in places like the Delta, where Black families are left with fewer and fewer options for care.
And as for Mound Bayou, it's still alive and kicking, and it's still a majority Black town. The town continues to struggle with a declining population and the economic fallout from it. The COVID-19 pandemic and recent natural disasters like Hurricane Ida have only added to the town's woes. But Mound Bayou has stood the test of time. Over its 134-year history, this town has quietly shaped not just the South and the U.S., but the world as we know it. It's birthed leaders that have forced us to ask the tough questions about our humanity. Leaders that have pushed us to speak up and to take care of those around us, and to find a yes when we hear no. Mound Bayou and Black rural towns all over, they got something to say, and they always have. As Eric and Shayla Brown moved forward with their plans to try for another baby, We heard this message loud and clear. On the next episode of Natal, we join Anasia Sturdivant as she charts new pathways to parenthood.